Hello there, it's Luke. In this tutorial, we're going to look at the physiology of a severe allergic reaction, type which we might refer to as anaphylactic shock, and the role of histamine in mediating those sort of physiological changes that occur. So just to quickly recap, you'll recall that when an allergen, so whether that's a food or a drug or some pollen or something like this, binds with a specific immunoglobulin E, those two things, once bound, can then bind and stimulate a mast cell to release the contents within the little granules. We call that degranulation. And one of the most significant things that it releases is a mediator called histamine. And histamine has widespread physiological effects throughout the body, many of which can be very helpful. It mainly stimulates changes in smooth muscle to either contract or relax. And you can see from this slide that there are various places throughout the body where that histamine mediated response will lead to a symptom that somebody may experience during an allergic or anaphylactic reaction. So we're just going to explain that in a bit more detail. So when histamine binds with the histamine receptors on the smooth muscle layer of a blood vessel, and here they are, you can see them there, it brings about relaxation of the smooth muscle. So the lumen, so the hole within the vessel, will get larger, and we refer to this as vasodilatation, and that's good in that it encourages sort of blood flow, so there's less resistance to blood flow through the vessel, and that's fine if we've got a small area of sort of tissue injury, because it means that oxygen and nutrients and other immune cells can get to the site and begin to sort of fix and repair and deal with whatever the risk is to the body. Now, it's this sort of increased blood flow that leads to two of the three signs of what we call the triple response of inflammation. So the red reaction and the flare are both sort of reddening, localized reddening of the skin, and that's because of sort of increased blood flow to an area because of local vasodilatation. Wheal formation, on the other hand, is due to localized edema, and we're going to talk about edema later on in this tutorial. I've just included a couple of slides here to demonstrate what an allergic urticarial rash looks like. An urticarial rash is one of these allergic rashes, and they can be very itchy, very uncomfortable, and there's another image there. So, histamine release causes vasodilatation, and if that occurs in a small area, there's an increased blood flow to that small area. However, it can occur systemically across lots of the blood vessels within the body, and that can lead to a situation where you have a decrease in what we call your systemic vascular resistance, which will have a knock-on effect in terms of your blood pressure and therefore perfusion of tissues to the vital organs. Just to recap that little sort of formula or relationship that we have at the top, blood pressure is equal to stroke volume, so which is the amount of blood that is ejected from the left ventricle on each contraction, times the heart rate, times systemic vascular resistance. Now, when you get this sort of widespread vasodilatation that is mediated by the histamine, then the blood becomes sort of spread throughout the sort of storage vessels, if you like, of the body, the capacitance vessels, and therefore you decrease your venous return to the right side of the heart. When venous return is decreased, it will decrease your preload and therefore the stroke volume, and this combination of effects makes the blood pressure drop in the absence of a significant compensatory sort of response. And as I've just said, this isn't a type of shock where you're losing lots of fluid, so you're not bleeding or vomiting or diarrhea or what have you. You're not losing fluid. It's just the fluid that you've got that would normally sit within your blood vessels, and your blood vessels normally being under sort of normal sort of muscular tone. Those blood vessels were relaxed, and so the blood is sort of the fluid within your body is redistributed. So this is referred to as a type of distributive shock. Okay, and I just wanted to remind you really that when we're looking at this relationship up here, we're talking about blood pressure, and blood pressure is important. It's one of the things that we can measure in clinical practice. Although it's not a straightforward relationship between blood pressure, hypotension, which of course means low blood pressure, and shock. So shock is the situation where you are unable to perfuse the tissues, and so cellular metabolism is impaired because they're not being perfused properly. Obviously, blood pressure has part in that, but if we're going to be very specific with our language, shock isn't necessarily the same thing as a drop in blood pressure. We're going to talk about another effect of histamine now. So we've got a sort of simplified diagram of a capillary, so the sort of smallest type of blood vessel that you have, and either side of the capillary we've got some interstitial space. And just to refresh your memory about this particular diagram, okay, there's a constant movement of fluid from within the capillary blood vessel to the interstitial space and back again, and this is driven by what we call the Starling forces. So at one end you've got hydrostatic pressure, so the blood pressure which is pushing the fluid out into the interstitial space, and that is countered by what we call oncotic pressure, which is the sort of movement of fluid back in towards the blood vessel, as the sort of water is drawn in by what we call the oncotic pressure, which is supplied by sort of proteins within the capillary. Now, what histamine will do is that it actually encourages the epithelial cells, so the cells that make up the wall of the capillary, to contract, and so there's more space in between them for fluid to leak out. And when we revisit our diagram, it's certainly not the case that there is more hydrostatic pressure. It's just there's greater sort of bigger openings. There's more, the capillaries are more permeable, they're more porous, and so consequently they let more fluid out of the capillaries than is returned due to the oncotic pressure. And clinically we would refer to this as edema. So we've got fluid gathering in the tissues that's not then being sort of reabsorbed back into the capillaries, into the blood vessels. Now, because the fluid is leaking out of the blood vessels and into the tissues, this again reduces the amount of fluid in the blood that is coming back to the right side of the heart. And if there's less venous return to the heart, then this will affect the amount of blood that is within the left ventricle. And if we have less blood within the left ventricle, then that of course affects preload, which will affect stroke volume, and that in turn will affect blood pressure and perfusion. So we've got these concurrent effects going on. We've got this loss of systemic vascular resistance. We've got leakage of fluid from within the intravascular space into the interstitial space, and a drop in our preload. And all of these things combined to bring us to this situation where we have a distributive shock. So, in summary, if histamine is released in sufficient quantities, it will cause widespread vasodilatation and leakage of fluid from within the vessels to the interstitial space. This can, if it's widespread, this can cause what we call an anaphylactic shock, which is a failure to perfuse tissues due to a redistribution of fluid from within our circulating system into the interstitial space. And the main factor, or the main mediator The main mediator is histamine, and the main effect that causes this drop in blood pressure and hence shock is this drop in systemic vascular resistance. Thank you very much for listening.